Sweeteners. Nutritive sweeteners have calories and can affect the blood glucose level like any carbohydrate source. Table sugar, honey, corn syrup, molasses, fructose, sugar alcohol. Sugar alcohol has about half of the carbohydrates of regular sugar. So it affects blood sugar less, but they can cause gas and bloatings and diarrhea. So you need to pay attention to how much sugar alcohol the food has. Non-nutritive, low-calorie sweeteners and sugar substitutes. There have been rumors that sweeteners are harmful for you. None of it is proven yet. The FDA has given the green light to different types of low-calorie sweeteners. They have set a limit for each sweeteners known as the acceptable daily intake ADI. This limit has a built-in safety factor 100 times the recommended amount. This means that even if you have 100 times more of these sweeteners daily for your whole life, it won't harm your health. Non-nutritive, low-calorie sweeteners and sugar substitute do not affect your blood sugar. They include aspartame, the blue packet, saccharin, the pink packet, stevia, green packet. Also stable when used in baking, except aspartame. Splenda is actually made of sugar. One chlorine molecule is added so your body cannot absorb the sugar. You taste the sugar, but you won't absorb it. Free food have about 5 grams of carbs or less and fewer than 20 calories per serving. This free food include baby carrot and celery sticks, 5 pieces. Sugar-free jello, 1 cup. Popcorn, 1 cup. Coffee or tea black or with a sugar substitute. Sugar-free soft drinks. Snacks. Snacks can help you avoid becoming overly hungry and they keep your metabolism high. Snacks containing fiber can help you feel full, such as fresh fruit, popcorn, a handful of nuts, quarter of a cup. Water. Next to oxygen, water is the most essential nutrition for the human being. Your body needs water to carry out all its function, from supplying oxygen to your cells to removing waste from your system. Adults need about 6 to 8 glasses of water or fluid daily. By the time you feel thirsty, you are already dehydrated. Opt for water instead of sweets or sweetened liquids such as soda, juice, and lemonade, which will raise your blood sugar quickly. Vitamins and minerals. Yes, that's correct. It's generally recommended for people with diabetes to get essential nutrition through a balanced diet. Still, there is limited evidence to support the use of vitamins or minerals in people with diabetes who do not have any deficiencies. However, some groups of people may benefit from multivitamin supplements such as elderly people or women who are pregnant or breastfeeding. If you take metformin for a while, you may need to ask your doctor to check your vitamin B12 level. We know that metformin is known to cause vitamin B12 deficiency if taken for a long time. In these cases, supplements may be recommended by your clinical team, but it's essential to talk to your healthcare provider before starting any supplementation regimen to determine if it's necessary for you. Sodium. Table salt is made up of sodium and chloride. Our body needs sodium to function. While sodium is naturally found in many food, it's also added to food during cooking or at the table. Consuming too much sodium can cause your body to retain excess fluids, which can increase blood pressure and strain your heart. If you have high blood pressure, reducing your sodium intake can help lower your blood pressure. Some studies suggest that lowering sodium intake can help prevent high blood pressure as well. Moderate sodium restriction is typically defined as consuming no more than 2,300 milligrams of sodium per day. Just one level of teaspoon of table salt is about 2,400 milligrams of sodium. Here are some tips to cut down on sodium. Put away the sodium shaker. Don't keep the salt shaker on the table during meals. Use less salt when you cook. Try to use less or no salt when you're cooking. Food label. Here's some tricks on food labels. Fat. You'll notice that amounts of the unsaturated fat in one serving is not listed. This does not mean that the food product has no unsaturated fat. It's just not required to be on the label. Cholesterol. Recommendation is to keep dietary cholesterol less than 300 mg per day. Sugar alcohol contain carbohydrates, but since they do not add to the product's sugar content, the product can be labeled as sugar-free. Pay attention to that. For most people with diabetes, it's no longer advised or recommended to subtract dietary fiber or sugar alcohol from the total carbs when carbs counting. However, if your team advises you to do so based on your individual needs, you may subtract half the dietary fiber or half the sugar alcohol from the total carbs if the serving contains more than 5 grams of fiber or sugar alcohol.